In this video, I'm going to tell you a little bit about what it's like to have a deep neck lift or deep plane facelift as far as recovery goes, as far as how long you need to stay in St. Louis if you're flying in for surgery, how long you need to stay in St. Louis if you're driving in for surgery, those kinds of things. If you have questions after this video, stick them in the comments below. So in general, if you have done your consultation with me virtually, I will want to see you the evening before surgery, actually the afternoon before surgery. So we can meet and greet, I can feel your neck, we can go over any last minute changes and plans, that kind of thing. On the day of surgery, you'll come into the office first thing in the morning, and we'll just kind of double check again we're doing the right thing. We'll get you into the operating room and we do the entire neck lift and facelift, if we're doing that, under deep sedation. You're deeply asleep, you don't feel anything or remember anything, but you're breathing for yourself, there's no breathing tube, and the recovery from anesthesia tends to be easier, and the bleeding and bruising during surgery tends to be less than general anesthesia. After a deep neck lift or deep plane facelift, you can expect to spend a minimum of 1 hour in my recovery room. That's an internal rule that I have. Even if you look great, you're feeling fine, you spend a minimum of 1 hour. Because if people are going to bleed requiring intervention after these operations, the very single highest window of likelihood is the first hour after surgery. So we make you stay with us for that first hour. If you're local, you live within about 30 minutes of the office, you can go back home. If you live larger drives, greater drives than 30 minutes from my office, we make you stay somewhere in the first 30 minutes or so. You spend a night or two at a local hotel. Why is that? Same thing. If you're going to require quick attention, it's going to be in that first night or two, and I don't want you driving an hour, 2 hours trying to get back to the office. 30 minutes is our window for that first night or two. The typical checkups after deep neck lift and deep plane facelift, we typically see people back the day after surgery. So if you have surgery on a Friday, I'm going to come see you on a Saturday. But we always see people back the day after surgery, first thing in the morning. We then also see you back generally on the second or third day if we're doing hyperbaric oxygen. I've been doing this now where we do the first couple of days of hyperbaric oxygen. I do believe it heals people more quickly. We see you back on the fifth day as well. So that usually is when we remove the drains. I have several videos on my Instagram TV about drains. Take a look for them during the deep neck lift series. The next visit is usually at about a week, so 7 days. So right around there, the night before surgery, plus 7 more, so 8 sleeps in St. Louis. That is the minimum amount of time that I feel comfortable with a fly-in patient staying in St. Louis. 8 sleeps, the night before surgery, plus 7 additional overnights. I feel even better if you can give me 10 sleeps in St. Louis. And why do I care? By that 7th or 8th or 9th day, all the stitches are out, the drains are out. What I am looking for are little subtle cues, little fluid accumulation, early infection, the kinds of things that I can see in person that I can't see on a photo, that I can feel in person, that I can identify just by kind of sixth sense kinds of things, and treat and nip in the bud so that you have an easy and complete long-term recovery. Sometimes I have patients say, well, can I come, 6 days in St. Louis or 4 days in St. Louis? And the answer is no. If there's someone in your hometown that was capable of doing the same aftercare at the same level, they would also be capable of doing this surgery and you wouldn't have to come see me. And so the aftercare is a huge part of what I do, and what my team does, truthfully. So anyway, if you're flying in 8 to 10 sleeps in town, 8's a bare minimum. If you can swing 10, I feel better with 10. If you're driving in, again, we have you spend the first day or two locally. After that, you can be driven back on the 5th day. You can be driven back on the 7th day, 10th day, that kind of thing. Usually after that 8 to 10 days, if you're coming in from far, far away, we generally don't need any more in-person follow-up visits. I kind of like to keep you calm, do some moral support, do some education, and we do what's called a video visit, usually about a month, another video visit a few months later. I have a great Instagram TV video that describes what a video visit is. And it's just how I keep tabs on you as you're healing, even though you're not local. If you do live locally, we'd love to see you in person. Again, just to kind of see how things are healing, keep contact with you, and we generally see people back after that first week or so about a month, about 3 months, and then really only if needed after that. Recovery-wise, pain, we give everyone that has a deep neck lift or deep plane facelift 10 pain pills. Half of my patients never touch them. So half of my patients take Tylenol alone and do not take any prescription pain pills. The other half will take some of the pain pills the first day or so. Many of them say it's just because they're trying to stay ahead of it or they're worried about it. No one so far has required more than 10 pain pills total. So it's not a painless operation, but it's surprisingly not painful. So Tylenol, again, is what most people do, or at least half the people do. And then the others take 10 or fewer pain pills total. Most people feel up to doing desk work 3 or 4 days later, if they can do it remotely by computer. In-person work, it takes 2 to 3 weeks by the time you feel presentable. You look beaten up, you look distorted. This is if we have a facelift. If it's only a neck lift, it's more like 10 days to 2 weeks. So neck lift, 10 days to 2 weeks, socially not presentable. Deep neck lift with deep plane extended facelift, 2 to 3 weeks, socially not presentable. So in less than that period of time, you really do look beaten up, you look distorted. If you're working on a telephone or computer, you are fine. But if you need to be seen by the general public, 10 days to 2 weeks, 2 to 3 weeks. Activity restriction wise, we have people avoid things that get their blood flowing, pulse and blood pressure elevation for the first 2 weeks. You can walk at this kind of pace all you want, but a pace that would make you short of breath when you talk, a pace that would have a young child complaining if they followed along with you, anything aerobic like that, you need to wait 2 weeks on, because we don't want the blood flowing so much that it generates bleeding where I worked. And we also don't want any heavy lifting or straining or big excursions of range of motion on the neck, stretching out my repair for 6 weeks. So 2 weeks of avoiding pulse and blood pressure elevation, 6 weeks of avoiding really heavy exercise, stretching, straining, that kind of thing. So the average person feels presentable at 2 to 3 weeks. Some people much earlier, some people a little bit later. Final results on a deep neck lift, 3 or 4 months. Final results on the facelift, if that's a part of what we're doing with you, more like 4 to 6 months. These operations, the way I do them, the deep neck lift and the deep plane facelift, are the most durable, the most permanent ways they can be done. The deep portion of a deep neck lift almost never needs to be redone. The external, the sliding stuff, the face, 10 to 15 years. We see very, very long-lasting results with these procedures. There's nothing longer lasting, so it's worth the time invested. I hope that was helpful as an overview of how long the recovery is, how long you need to stay in town, when you look presentable, when you feel pretty good, when final results are. If you have questions, things that I didn't cover, please put them in the comments below. I'd be happy to answer them. Thanks for watching.